I think we will go ahead and get started. We're a small and mighty group today as we go through today's session. So welcome to today's session on Let's Talk About Parental Leave. And I am delighted to have with us today Courtney Drysdale, who is a research and instruction librarian and associate professor for Regis University. She was a formal high school math teacher and an elementary school teacher librarian, and she enjoys teaching information literacy classes and working with students and faculty on research individually. She is the liaison to education, math, and chemistry. And I met Courtney a while ago because she was the conference co-chair for the Colorado Association of Libraries in 2019. And her research interests include first-year students and library instruction and creating welcoming library environments. So I'm going to turn it over to Courtney.
Christine. Every time we mention CalCon 2019, I just think the before times, which is helpful. But yes, I've known Christine since the before times. So thank y'all for coming. This is a project that is really close to my heart. So thank you so much for being interested. And hopefully, if you're watching this recording later, that this is helpful for others to view and see how we can advocate for these things as well and validate people's experiences. So I'm going to share my screen and have a presentation to show you all. If you have questions, feel free to pop them in the chat. Since it's a small group, we can, do questions along the way. It's whatever we want to do. But yeah, thanks for being here. We are doing this. Let's talk about parental leave. So I'm Courtney Drysdale. I use she, her pronouns. And as Christine said, I'm a research and instruction librarian at Regis here in Denver. And I am also a mom of two. They are 6.5 and just turned 4. So today, first we're going to discuss this project that I worked on and the results, the background behind why I chose to do this project. It was actually a sabbatical project a year ago. The literature that I searched for, the survey instrument itself, and then the results, both the multiple answer questions that people had, and then some open-ended questions. I do have the slides available as well, so here is a link for that. We'll also do a little bit of sharing. It's a small group, so that'll probably be a little shorter. And then any questions that anyone has about the project or about parental leave in general, or just about advocating for policies that are positive for caregivers, but often those policies are positive for everyone. So first we'll talk a little bit about the project background. So first, why this project? Why parental leave? So this is a picture of me and my younger child when she was about 6 weeks old. So this was halfway through my parental leave, the second time I had parental leave. And most of that time was unpaid. So it was a really challenging and vulnerable time that I found myself in. And I really just wondered, why is parental leave so hard? Like, why does it have to be this difficult? This is something that so many people go through, that is like a normal part of life for a lot of people that choose to have children. And I just couldn't get around, like, why was this so hard? And if there is anything we can do to make it feel better, even if we can't change policy. I've been trying to get the policy changed at Regis for 7 years, and it has not changed. It is still unpaid. So, sometimes we can't change policy. And when I started this project, I wanted something that I could do that even if I couldn't change policy, even if we can't get legislation, especially for a federal family leave policy, how can we still support people and help them? And then which policies should we put our efforts into advocacy for? So if we are going to pick something to advocate for, what should it be? What would be most helpful? So looking at that, I looked at the research question, which policies help academic librarian mothers feel supported before, during, and after parental leave? And I limit it to academic librarian mothers, partially because it just needed to be a more narrow population just to be able to have it be manageable. But I also chose to focus specifically on mothers rather than parents because it is a different experience, or it can be a different experience depending on if you are a mother, a father, or a parent. You know, it may be different for you. So I wanted to capture just that, especially because librarianship is a majority female profession. I thought I want to focus on mothers for this project. So first thing, of course, I looked at the literature. So I did some basic searching. I wouldn't be a good librarian if I hadn't. So I did some searches in different topic areas. I'm not going to do a summary here. I am currently writing this as an article and I will have the full literature review in that. But at first I looked in for articles around parental leave in academic libraries to see if anything existed. There are a few things. Parental leave in higher education in general, next. And then just parental leave in general. I also pulled a couple of things about parental leave. Regis is a Jesuit Catholic institution. So I pulled a few things about parental leave in Catholic institutions as well. And then also found a few really good articles actually about librarianship and motherhood. So I thought those were really great and deserved to be mentioned as part of it as well. I have a link here in the slides if you want to see the lit searches, the results that I had. I also consulted some books to be able to find different policies that I could use as examples in the survey. So I looked at books to see the different types of things that exist and be able to make the survey. So we'll talk about that a little bit later. So next, I wrote the survey. So I worked on writing this back in fall of 2021. So I worked on writing the survey based on the literature and also based on some of my own personal experiences with the different policies available, some other research that I have done on policy availability at Jesuit schools and also at the other universities and colleges in Colorado. So based on those and what I saw was available, I kind of built the survey out to see the different types of things people might have available to them. So I do have a link to the full survey document written out so you can see. I'm dropping that in the chat now if you want to look at it. But in summary, the survey was distributed in February 2022. I was on a sabbatical leave, which I will always make sure to note my sabbatical leave was paid and was much longer than my unpaid parental leaves. So I distributed it there. I posted it on Twitter. This was before Twitter became what it is now. This was before Twitter was purchased. So it was a great place to be able to get some responses. So about 130 responses came from posting it on Twitter, which I thought was really neat. I was able to use different links in Qualtrics to see kind of where everyone came from. So about half from Twitter, and then I also posted it on several academic library listservs and got about 120 responses from there. Of the 253 respondents, I ended up with 227 eligible people that got to continue. So there were 3 qualifying questions. It was basically if a child joined your family in the last 10 years, so at the time 2011 to 2021, if you worked at an academic library in the US at the time, and if you took any type of parental leave, whether it was paid or unpaid. So they had to answer yes to all 3 of those, and then they could get through. There were 5 multiple answer questions where I was asking them about different policies, and then 4 open-ended questions where they could share a little bit more about their experience. And then 6 demographics questions so that I could try to break things apart and see if there were perhaps areas of the country that were doing different things, different types of universities. So I looked at public universities, private secular universities, and private religious universities and colleges. And then also looked at like status of librarians, so whether they were faculty or tenure track. So I looked at all of those, and then the survey was open for about 2 weeks in February. So we'll look at a little bit of the results. So we'll start with some of the multiple answer questions. These are a little bit small on the screen, I will admit. So if you want to see them a little bit better, that link for the actual survey is in there. And then you can kind of read the answer choices better on there, but you can see them on here. The first, it's question 4 because of the first 3 qualifying questions. So participants were asked which of the following formal policies, so these would be policies that are written in at the institution level or at the library level, were available to you when your child or children was born, and they could choose all that apply. I will make a note here that this question and a couple of others, my intention was for this to say when your child or children joined your family, because I didn't want to exclude people that adopted or they're welcomed their children from foster care or in another way. So I acknowledge that as a mistake, and I did have a couple people point that out to me. In other parts of the survey, it does say when your child joined your family. I regret that this one was not changed, but I just want to acknowledge that here as we come across it the first time. So these were the policies available to them. It does not mean that the individual used these policies. It just means that they were available to them through their institution or their workplace at the time. So you can see I put these in order of numbers. So the most people had access to FMLA or family medical leave, which is an unpaid job protection, basically, and is a federal law. So that is what most people had access to. Most people also had vacation leave and sick leave, which is also pretty standard. 101 had paid parental leave from their institution, which was honestly more than I thought I was going to see. So that's wonderful. A lot of institutions are getting on board with that. Fewer had short-term disability insurance, which is also not actually parental leave, but can be used for, if you're the birthing parent, then you often qualify for short-term disability for 6 to 8 weeks, depending on your policy. Some also had access to unpaid parental leave, which was not part of FMLA. I included this because that was one of my experiences on my first parental leave. I had not been at the university long enough to qualify for FMLA. And so I just had other unpaid leave, which was basically unprotected, unpaid leave. There's also a few people, 48, that had a formal flexible schedule policy. Only 35 had a formal remote work policy. 27 reported paid family leave through a state program, which is, there are more states that have it now than when this was out. And then a few said other. So most people had access to like typical things that everybody would have. And then it kind of went down from there. So after that, I asked them how helpful these policies were to them. So basically the answers on the previous question would carry to this one. So that then they would only respond to the ones that they answered that they had access to. So that's why some of these numbers don't add up. So these are in the same order as the previous slide. So the most number of people had access to them, and then they rated it from not at all helpful to extremely helpful. And you can see the ones that most people had access to were kind of across the board. Like they didn't rate them as extremely helpful. It was kind of scattered all about. The one that stands out the most as far as like people found it extremely helpful if they had access to it was paid parental leave. So, 68% of people said it was extremely helpful to have paid parental leave out of the 94 that indicated they had it. I don't know who the one person was that said it was not at all helpful. I'd like to talk to them more. So you can see it kind of goes more towards the helpful end of the scale. We also had a few, I'm trying to see, most of these were like either scattered around, not a ton that said like, this was not helpful for me. So it seems like having policies available in general helps folks, but that the ones that are that involve pay tend to be more helpful. So like paid parental leave, sick leave and vacation leave are generally paid. So those tend to show more helpful than things that were unpaid, like FMLA. And then things like flexible schedule or remote work, like they were helpful, but not as many people even had access to them. After this, I asked them about informal policies. So the first one was kind of like, if we're going to advocate for a formal policy, what should we put our energy in? And then, but there's also the aspect of, if I can't change policy, what could we do for each other? How could we care for each other, even if we can't change a policy? So I asked, which of the following informal policies or practices did your workplace, library, or department have to support you as related to preparing for a new baby, being away from work to care for a new baby, or returning to work after leave? I also here probably should have said child instead of baby, because often people that adopt can adopt older children. So in this one, we had, I made a list for this because I didn't want this to be an open-ended question. So I made a list based on my own experience, what I've seen in books that people have done. And then honestly, I don't know if I've said this out loud before, but I asked a Facebook mom group of a bunch of working moms, what are like informal things that your workplace did for you, and got some ideas from there as well. And they were not all librarians. It was just like a working moms group. But they gave me some ideas as well of things that maybe I hadn't seen or experienced. But these are a little bit hard to read, and I apologize. The choices are easier to read on that link I gave you. But the most people that said the things that they had was a celebration for them or their child, like a baby shower or a welcome back, like coffee thing. Time for lactation needs, if applicable. Not everyone needs that or chooses to do that. Space for lactation needs, flexible scheduling. So this would be like not a formal policy like in the previous question, but more like something that's not written. Maybe it's just something that's allowed. Flex time for appointments. And then something like a preferable schedule, like no weekends or no evenings. Maybe if you travel, less travel, or like shifting your schedule in a way that is preferable to you. Or a change in duties, which would also be something like less travel, fewer shifts, things like that. We had other reduced hours, and then just a few people had a bringing new baby to work possibility for them. So yeah, the most were around lactation, and then around a celebration were things that people indicated that they had kind of available to them, or that maybe they would have seen at their workplace. And again, they were asked how helpful or not were these informal policies and practices. These are in a slightly different order, just because of how a few different, I don't know, I think the top two are out of order. But the ones that were more helpful were a little bit different on the informal practices. So time for lactation needs and space for lactation needs were really high up there, which is really important, and something that it is part of law, like having a space and time for lactation. But I put these under informal policies and practices because while it is the law that they have to provide these spaces, it's not necessarily the best of spaces. It's not always ideal. So the most people indicated that it was extremely helpful, especially to have the time for lactation needs. Librarians have really busy and kind of different schedules. So it's, sometimes you have to really figure out how to make that work. Space for lactation needs was up there as well on the higher end of helpful. Also flexible scheduling. So I was happy to see that like flexible scheduling is really helpful for people. And that's something that is pretty easy to allow people to do. I know we work around like service points sometimes, but knowing that that is helpful for people, it helps, hopefully would help, you know, supervisors, department heads know that like, this is a small thing we could do that would help someone feel supported. There's also flex time for appointments. A big thing on parental leave, especially if you have to use your sick and vacation, you often have to bottom out those leave balances. So often people that have been out on parental leave or medical leave, even if it's for yourself or something else, you come back with no balances. And then if you have a child that is suddenly in daycare, you really needed that sick time. But being able to have flex time for appointments might get around some of that. If it's an infant that someone is welcoming, they have so many appointments. So many appointments. So it looks like flex time is really helpful and supportive for people. There weren't as many that said it, only 20, but the majority of people, if they did get to reduce their hours, it was helpful for them. And then I found it funny, this bringing new baby to work. It was only 10 people, but it was different experiences for everyone, I guess. But yeah, and then the thing that most people had access to was the celebration. And it was, you know, it seems like maybe a nice thing, but not the most helpful thing we could be doing for people. I think it's probably worth doing to acknowledge a change in someone's life. But if we had to pick one thing, you know, I'd be more looking at like flexible scheduling, flex time, and really that lactation space, because that is another really, you know, all of this is very vulnerable. And then it continues to feel very vulnerable as a lactating person when you are back at work. So, you know, I think those kind of stood out to me as things that we could really do in a library without much disruption to services or like a large burden on others in the departments, you know. So those were the multiple choice answers. I'm going to pause because I feel like I've been talking a while. Does anyone have any questions about the initial like survey or the multiple choice questions before we go into open-ended? All right.
Them into chat, or if you have experiences that you would like to share as well.
Yes. Awesome. So let's look at some open-ended. So when I presented this before, I've included a lot of the open-ended quotes in the presentation, but for the sake of time, I'm not going to go over a ton of them today, but I have included a document with some representative quotes because I feel like it's really important that I'm able to represent the way that people spoke about their experience really, really authentically. So I always want to include direct quotes from participants as part of sharing this information. I feel a great responsibility of kind of carrying their experiences forward. So I'm always making sure to get their actual words into it. So since these were open-ended, I needed to do coding. So open-ended questions, it's just all written. So I had to decide what the categories would be and then group them. So I used a software, a web software called Taget. Has anyone seen Taget before? I love it. So I would highly recommend Taget. It's great because you can actually highlight the things you're doing and then tag them as multiple different things. So I really liked using that. I took each one and did it separately in Taget. And then I made tables created with numbers from each category, which is what I'm going to show you in the next slides. And then quotes were selected to represent some categories. So either like the categories with the highest numbers, or sometimes I found something that was just surprising that I didn't know someone was going to talk about. Like later people talk about like support for childcare. I didn't think about that. And not a ton of people said that, but it was kind of an answer that was more surprising. So I have a link to the quotes. So I'll drop that in here. And Amy, I see your question, so we'll come back to it. The HR stuff comes up in these open-ended questions. So there's a link to the selected quotes. So in these, I wrote it correctly about when your child joined your family. So thinking about all of the formal and informal policies available to you when your child or children joined your family, what was most helpful to you? So I wanted to give people an opportunity to say, like, if I could pick one, what was it? And so these are the different codes that I found when I read through the results. The top two had actually exactly the same number of responses. 48 people talked about paid parental leave, and 48 people talked about flexible schedule. So one of those is difficult to get, paid parental leave. You either have it at your institution or you don't, or in your state. Flexible schedule is something that could be a little bit more attainable. After that, people also talked about vacation and sick leave being helpful to them. Again, that is paid. So when we're thinking about things that are helpful for people, it's that flexibility, and then it's pay, either paid leave or leave that is paid, so vacation and sick leave. After that, people also talked about lactation space. I mentioned earlier, it's another time of vulnerability. So having a space that makes you feel comfortable and able to do that is really helpful. Remote work also got called out a lot. 29 people talked about that. We also had quite a few people talk about, since this was in 2022, still very pandemic-y, but we had people talking about their parental leaves happening like during COVID and how that changed the remote work situation. And many people commented on, like, I think it may have been different if it weren't COVID, but 26 people said that FMLA was most helpful to them. And I can understand that as well, as knowing that, like, your job being protected could be the most important. Several people called out a supportive supervisor and then supportive colleagues. These are all things we can do. We can be supportive to other people. So I want to make sure to call those out. Lactation time also came up. And then a few people talked about, like, the amount of leave time. These are generally people that had longer amounts of leave time. So they talked about, like, that being good. And then a few other things came up with, like, 7 or less, short-term disability leave, reduced hours, the schedule. A few people said nothing, which was a bummer. A few talked about their state family leave policy. Supportive admin, I pulled that out separately because in academic libraries, that is quite a different thing of having different supportive supervisor colleagues or your admin. A few people talked about donated sick leave, which that concept bums me out. But I guess it was helpful for some. A celebration and then baby at work, those were all pretty small. And this question, Amy, this we'll get at some of the HR stuff here. So I wanted to know if they had any barriers to using formal and informal policies at their institution. A lot of people reported no barriers, which is great. But then a lot of people talked about knowledge of policies. So I think this speaks to what you were asking as far as, like, if I measured any messaging from HR. Oops. Back. Sorry. And then other barriers were that the lactation space was lacking, that they had to exhaust their leave balances, I mentioned earlier. And then also these, I think, also speak to the clear policies, human resources difficulties, and paperwork. We also had subjective informal policies called out, institutional culture. Some people talked about not having time for lactation needs. And then a few people specifically talked about money. And then again, related to policy, that they didn't qualify for a leave policy. And then a few people called out that they got rude comments, which is, like, just a shame. That's not what anyone needs going through that time in their life. So it did show up here in, like, looking at policies, messaging from HR, that people found it confusing and often didn't even know that things existed. And then they don't even know who to ask. So I didn't measure anything specific to this. I have looked at, in a different project related to parental leave, I've looked at all of the policies at all of the Jesuit institutions and all the states, universities and colleges in Colorado, the state. And it is sometimes very hard to find them. So I think that would be a really good thing to look at further, but it wasn't really captured in this study except for here talking about barriers. Does that answer your question? Thanks. So yeah, I was hoping if we talked about barriers that we'd be able to look at ways to get around those barriers, to take those barriers down for people. So like knowledge of policies, like we can really make sure if we have experienced it at our institution that we can make sure to pass that knowledge on to other people. And that doesn't fix the policies, but it just helps care for people. So next, I asked, what everyone wants, what they would have wanted. So what support do you wish you had had as related to preparing for a new baby, being away from work, or returning to work after leave? And the most people that said something the same was paid leave. They also talked about wanting remote work, which was, again, kind of different as far as like pre or post COVID. A lot of people talked about wanting more time off. 31 people said that. Flexible schedule. And then this childcare support one was one that I hadn't thought about and hadn't listed in any of my things. But a lot of people talked about wishing they had help either from an on-campus daycare, which is a thing. They're usually really hard to get into from what I hear. We don't have one at Regis, but it's something that people have talked about for years. Like, man, I wish we had an on-campus childcare. Like students could work there and we could have our kids here. Like, but I didn't realize how many people would think about that, and not just like, I wish we had an on-campus daycare, but also I wish I had help finding childcare, even if it's not on campus. People also called out wishing they could have like gone part-time temporarily. And then again, lactation space and better knowledge of policies and consistent policies came up here again, that people wished they understood it better. And then a few here at the end, ability to bring baby to work. And then people wishing they had supportive colleagues, understanding supervisor, close parking, but that was a nice one. I would have liked that because parking is very difficult. Reduction in duties. And then also a few people called out directly more support for foster or adoptive parents. Oh, I'm seeing Christine's comment. Someone who paid for daycare to hold her spot for several months before the baby was born. Yes, that is all too common. Childcare is rough. That could be a whole other presentation of like just people struggling to have adequate childcare to be able to do their jobs. So yeah, and then the last, I didn't include it on here, but the last question I asked in the survey, and that is in the quotes, there's some representative, well, not really representative quotes, but some quotes in the page is, I just asked like, is there anything else you want to say about your experience? Because often that just gives people a way to, if there's anything else I didn't ask about, they could ask about it there or tell me about it there. So I think it's important to give people that space, but there weren't any there that I didn't do a coding on those because there weren't things that people had in common. So I just picked a few like representative quotes from those. I'm trying to see if I can pull it up. There it is. No, wrong one. Also wrong one. So it's this last one I gave you. So like these question 12, they talked about amazing colleagues. They're the ones that bent policy for me. When I first started reading all my survey results, I read this one. I found the entire process demoralizing and deeply upsetting. I was tempted to call my presentation at one point, parental leave, demoralizing and deeply upsetting, but it's not everyone's experience, so I didn't do that. but yeah, there were people here too that indicated that they are no longer a librarian at an academic library because it was not friendly to them. But then a lot of other people talking about like being able to get that support from their colleagues. One of my favorite ones down here too, at the very end here, it's a huge personal and medical event that is honestly life and death. Well, after the baby's here, employers need to respect that so much more than they do. So I will stop there as far as like looking at the results, but there are more quotes here. I would encourage you to look at them to see those actual voices of moms. So what we're going to do now is do a little bit of sharing if you want. You do not have to. We're going to share through a Jamboard. If you've used those before, you can like write on little sticky notes. That makes it anonymous for all of us. So you can say whatever you want, or you can say nothing, and no one's going to know whether or not you said anything. Most of these questions are kind of designed for people that have experienced parental leave, but if you have not, you can also think of it as maybe it's something for the future, or maybe it's something that is just good for you to know as a colleague, because a lot of these policies, besides parental leave, that's pretty specific, but like medical leave is really, like paid medical leave and family leave is really important, whether you're a parent or not, because we all have people in our lives that we may want to care for, or we may need to be cared for ourselves. And so things like flexible work and remote work and all of those policies are supportive for all people, not just parents and caregivers. So I would encourage you, as we look through this, it's okay if you've not experienced any of these things. You can think about future or about just others around you. So I'm going to jump over to the Jamboard, and I'll stick the link in here for y'all. And I'm just going to switch over to it. Perfect. I see y'all getting into it. So if you haven't used Jamboards before, they're just like slides, but you can add things over here. So like if you just click on this little sticky note, you can pick your color, and then you just type in it, and then it appears on the screen. I put some in here to get us started. And you can feel free to click through all of these and answer at your own pace. There are 6 pages. And if these don't apply to you, you can feel free to skip them or answer them in whatever way makes sense to you. But the first one is just, let's find out who's here. This is not me asking you to put your name on this. It's just asking me to put, like someone put here to learn about it and support others. This is mine, a mom of 2. I took parental leave twice at the same job. So I am going to stop talking and give people a few minutes to add whatever you want on here. You can also feel free to add any questions you have, or if there's just something you want to understand more, feel free to add things on here. So I'll give us maybe like 5-6 minutes. I'll keep looking through and make sure we're getting through. give us maybe 1-2 more minutes since we're a small group. If there's anything else you want to add. All right, thank you for adding these things. I really appreciate y'all processing on the Jamboard. It looks like we're mostly either for the future, maybe in the future, in the fall, or here to support others. So thank you all for being here, and thank you for sharing your experiences and caring about these things. It honestly, it makes a difference that people care about what you're going through. So yeah, let's look at a couple of these. So it looks like for people that have experienced it or have heard about others' experiences, I think this is totally valid. Thank you for sharing what other people have said. So I will say mine is the mixed ones. No paid leave, but I did have kind colleagues who tried to care for me, had people that went to our boss and were like, maybe Courtney shouldn't have to work late at night while she's hugely pregnant. And that was really, really helpful. So yeah, mixed. Great from my kind colleagues, not great from the institution itself, which they know about. I never stopped yelling about it. And then I see some people added some negative things here. So someone put, can only speak to the preparation to go on leave, which I'd say has been negative. Thank you for sharing that. Whoever put that there, I completely empathize with you because mine was also quite negative and stressful to get ready for. So yeah, I wish that weren't everyone's experience, but even just prepping can be kind of challenging sometimes. So I will also say, if anyone is feeling that way and wants to talk to someone who can understand, you can feel free to reach out to me directly. And then a couple of people sharing that they haven't experienced it, but see that other people have navigated systems and many jobs has been overwhelmingly negative. And then another that said their friend had to rely on sick time donations from the office staff to get paid after she had her child. That is such a bummer. And yeah, I love that this person also said this. I was happy to help, but sad that was her only option. Like, it should not be that we're having to donate sick time for other people to have time to recover from birth or time to get to know their child. Thank you for sharing those. And then the most helpful practice, these are, you can tell which ones are mine. Flexible schedule is the most helpful thing for me. And then someone else wrote organization, paid leave, flex remote hours, and part-time after FMLA runs out. That sounds great. Those are good. I hope those are really, really helpful. Then what do we wish employers or coworkers knew about your experience with parental leave? That it's not a vacation. People acted like I was off having a good time. I was not. And then someone else wrote, I wish HR at my employer was more compassionate and willing to sit down and explain/help me. That is such a good point, and something that so many people in the survey brought up was like just really wishing that someone was helping them navigate it, whether it was HR or a colleague. Like, they really just wish they had someone to sit down with them. So that's good for us to know.
I was just going to say, that seems like it should be the most basic thing. Like, whether or not somebody in HR is also a parent and has been through that at the organization, like, you know where the policies are. Somebody should be able to book a little bit of time with you to sit down and be like, these are what your options are. Whether the options are good, bad, or otherwise.
Right.
It seems basic. I don't know.
You would think. I should say too, if anyone else wants to jump in and talk, please feel free to unmute and talk. I just don't want anyone to feel like they're having to claim their whatever they wrote on here. So I want people to stay anonymous if they want to.
chat will not be included. So the chat part does not get recorded. So if you want to add things in chat, I'm happy to read them out loud, just in case we do want to protect people's privacy. So.
Yeah. It is, I feel, I will say, having gone through the experience and then having read so many people's experiences, it is like there are such basic things that we could be doing, like just to treat someone human, that would make a difference. And I think that's what's frustrating. So it's part of why I wanted to do this project as well, is because my experiences were quite similar. And I just don't want that to happen to anyone else. And apparently it's happening a lot. So I'm sorry. And then someone just added this: how can we advocate for ourselves and others, help walk others through it if they need it? I think that is huge. I have everyone that has had a child after me in my library, I have talked to them about it, and we'll continue to do that. I think that's a huge thing to do. Encourage informal flexibility when possible. I'm seeing we need to have more conversations about things like this, talk, build communities, join voices, give and receive grace surrounding colleagues starting their parental journeys. That's huge, because I guarantee they feel awful for needing to, it's difficult to need to have that from others when you feel like you're in a difficult transitional period. And then I love whoever put this, that this is a DEI issue and needs to be treated as such. I completely agree. And then someone wrote about the Colorado's Family Act, which did pass. And so we here in Colorado will be able to have paid family leave starting in 2024. So yay, go Colorado.
Sorry, I was just looking at this because one of my coworkers at Cerebral, which is my part-time job where I bartend, he and his wife just had a baby in 2023. And it turns out that if you're welcoming a child in 2023, you can still take time in 2024 within 12 months of your child's birth. So his kid was born in middle of April. And so as long as he takes his 12 weeks paid before whenever that due date or whenever the day they had the child was, they can still do it. So if whoever's preparing for that, if your child is going to be born in 2023, I just thought I would throw that in the chat because it was exciting.
Oh, wow. That is exciting. Thank you, Sarah.
Yeah, well, I mean, and this is embarrassing a little bit for Regis, but Cerebral, a brewery, offers 6 weeks of paid parental leave for the mother and the father, or the two parents, I should say, excuse me.
Yes.
So yeah, so it is really cool that that's happening in Colorado. It should be the standard for the whole country, but at least we're starting here.
Yes. Thank you so much for sharing it. That's huge. I didn't realize they could still do it in 2024 if you have a kiddo in 2023. That's
because apparently we started paying for it this year.
Yes.
So since you're already as an employee contributing to it, you get the benefits in 2024 even if you have a child this year. So I thought that was pretty cool.
That's huge. That makes me want, I'm gonna like post that in some of my local mom groups to make sure if anybody's having a baby this year, they're gonna.
Totally. I just texted my friend about it too. I was like, hey, I want you to have this.
Yeah, this is another place where like knowledge of policies and legislation would be helpful for people. That's awesome. And then this is also going to cover like other types of leave as well. So it's also something we need to be aware of starting next year. Thank you. And I'm glad to hear that Cerebral has paid leave as well. It should be the bare minimum.
Yeah, lucky. I mean, I've been working there 5 years tomorrow, and there's a lot of reasons why, but that's just one of the many. They really take care of their people. And the other piece of that is it's not your full salary. I think you could get the full thing for four weeks or the half salary for 8 weeks, but still it's better than not paid at all, so.
Absolutely. That's huge. There are a lot of places that have good policies. But I will, as Sarah said, and I will echo, Regis does not have any paid leave. So that was our last question for advocacy. Thank you so much for sharing. Did anyone else want to share anything around advocacy or anything else, either in the chat, or you want to say anything as we are headed towards the end?
Yes, I just have a quick question, Courtney. Maybe it's
Yeah.
not a quick question, it's probably a long question, but I'm just curious, have you thought about or had conversations around like how to take this information to a variety of different types of libraries and employers and create some sort of action out of it? Because clearly there's gaps no matter where
Yeah.
you're coming from.
Yeah, great question. I have not personally figured out how to like advocate for this, like a toolkit or anything for libraries, though now that I just said that out loud, that would be really good. So I will think on that. I did find some other organizations that advocate specifically for paid leave, which are here at the end of this. Chamber of Mothers is one of my faves, Moms Rising. So there's a lot of organizations that are doing the work around paid leave. But as far as anything else, as far like with the informal things and things that might be more related to libraries, no, I don't have anything like that, but that does spark that's a really good idea. Because I think there is something specific to like different types of libraries and how we all have a lot of the same types of services. So we have a lot of the same types of like service point coverage needs, and we're also, you know, majority women profession and in all the different library types. So that's a wonderful idea. Thank you for saying it.
And I think part of it can also be, that was one of the reasons that I asked Courtney to do the webinar. I knew that she was doing this research as part of her sabbatical. And then I happened to see it come across on Twitter when she had it done. And I think part of it is like, once again, getting the word out to people that might not know that they need to know the word, sort of, you know. And so as I post the recording and stuff, feel free to share it with colleagues and other people so that at the very least, they know what people are starting to talk about, especially those informal things that can be done at a department level, just even between colleagues and peers. I think that's a good place to start. I think, you know, potentially the reason we didn't have more people show up is one, academic was mentioned in the title, and library types, like, you know, they're like, oh, it's only for academics. And no, it's for everybody. And if you're not currently a parent, but much of what Courtney was talking about, I am now getting to the point where I will be doing more care for my mother. And these same policies need to be in place, because I don't think people quite realize, especially as healthcare continues to change, perhaps not for the better, we're going to be all of us are going to be spending a lot of time caring for our parents. And it's, you know, they're all part of the community. They're all part of our families. Like, this is something that kind of needs to happen. So I think the more we can talk about it, the better, and just kind of continue to get the word out there and have these conversations.
Yeah, absolutely. And I will say too, and I can share this other Jamboard I have. I've done this before I did the whole survey. I did a conversation presentation at CalCon that was a lot of these same questions we talked about today on the Jamboard, but it was more broadly for caregivers. So not just parents, other people that are caring. There were people there that were caring for parents, caring for disabled spouses, siblings. So a lot of these policies, I mean, I'm talking directly about like paid parental leave, but like Christine said, so many of them apply to lots of different people, lots of different caregivers. And it's an important thing for us to know what other people might be, what they might be needing to have support in their life. So, thank you. Any other questions? Okay. Well, my email is here if anyone has any follow-up, or if you just want to commiserate and have some support, please know that I'm here for you. It's, you know, one of the most difficult things I've ever gone through, and one of the most valuable things I've gone through. So I hope that this was interesting or helpful for anyone. And thank you so much for being here, for supporting this work, and for talking about this, because the more we can talk about it, the more we can hopefully make changes that just help people feel a little bit better. So thanks for being here.
Yeah, I concur. I want to thank everybody for attending today. I especially want to thank Courtney for sharing her research and for giving us opportunity to kind of provide our own information and feedback and questions to this session. Before we leave today, I am popping a quick survey in the chat. It's just a brief survey that we provide for any of the state library presentations that we offer, but we are very interested in your feedback, and I'm more than happy. It's anonymous. I'm also happy to share it with Courtney as well. So if you'll take a few moments to fill out the survey. But once again, I want to thank everybody for attending this afternoon, and the recording, hopefully she'll be up maybe later this afternoon, but definitely by tomorrow on Libraries Learn. So I want to wish everybody a great rest of your afternoon.